All right. Well, hello, everyone. Thank you so much for joining us today. My name is Wendy Hicks, and I'm the Assistant Director of Recruitment and Admissions. And I just want to welcome you to the Admitted and Prospect Applicant Department Overview for the Department of Environmental Health. We're really excited, and so I'm going to turn it over to one of our awesome ADAPs, Ms. Ariadne, and she'll get us started. Thank you for attending.
Hi, welcome everyone. We're so glad that you could join us today. We are going to give you an overview about the Department of Environmental Health here at the Rollins School of Public Health. And I'm going to introduce you to who's on the phone. We're having some technical difficulties here. There we go. How'd you do that?
I just clicked on the screen.
Okay. All right. Gotcha. So here we are. This is who's in the room with you today. So we've got Dr. Karen Levy, who's the Associate Professor in the department, also jointly appointed with Global Health and Global Health?
No?
Epidemiology and Environmental Sciences.
Thank you. And I am Ariadne Switzenberg. I'm the Associate Director of Academic Programs, also known as the ADAP or the Advisor for the department. And we also have with us Stephen Sola.
Hi, everybody. I'm a second-year environmental health and epidemiology student here in the environmental health department.
So we're going to tell you a little bit about the overview of our department, introduce to you to more faculty through our presentation and the research areas and the focus of what we do here. And I will also talk to you about academics and the types of degrees and prerequisites and a little bit about the curriculum overview, as well as practicum and employment opportunities and what that looks like from environmental health. And Stephen is going to talk to you about student life. So I will turn it over to Karen for the department overview.
Great. Well, welcome everybody. I wanted to tell you a little bit about the department. So the ultimate goal of the environmental health department is to promote a healthy environment for all people. So we're working in novel disciplines and applying novel methods and technologies such as exposomics, environmental bioinformatics, high throughput analyses, remote sensing to really address these big challenges facing us in the future. And we're incorporating a lot of the most modern techniques, epigenetics, genomics work to look at these endpoints of interest. We really have an expansive view of environmental health in the department. We are looking at things from the molecular to the global scale. So we're considering both, like I said, these technologies that allow us to look at molecular epidemiology and omics scale data, all the way to bigger picture issues like globalization, emerging economies, and climate change. So we really do take this expansive view of the field. We also look at both issues of toxics as well and chemical exposures, as well as infectious diseases. So both chronic and infectious diseases. Ariadne will tell you a little bit about the statistics about the department and get a sense of the size and scope.
One thing that's interesting about the Department of Environmental Health, it's a little different from other departments, is we are still one of the smaller departments at Rollins, and we have about 100, you see here, 93 master's students currently, and it ranges between the three different programs, which we will talk about a little bit more in detail, but the majority of our master's students are in the Environmental Health MPH program, and then about a quarter of them are in the Global Environmental Health MPH, and then 15 right now are in the Environmental Health FE, which is an MSPH program. And we also have a program with the undergrad Emory College, which is a 4.4+1 program where sophomores can apply to start taking classes and joining us as early as their junior year. So it's exciting that we have students starting as early as their junior year at Emory College, and those are for environmental sciences students for BS program. And we have about half of those students are first years and half are second years. And we also have 30 doctoral students in environmental health sciences, which is also managed in our department. We have 18 to 20 now. We just made a couple new hires, primarily appointed faculty in our department, and 12 of those are jointly appointed with other departments, and we have about 58 or 60 adjuncts and visiting faculty from all over, not just Atlanta, but internationally as well. And one thing that's really nice about the size of our department is that it is large enough to have a lot of resources and networks, but we're also small enough where the cohorts get to know each other really well, and it's very intimate, and we have a great faculty to student ratio, and there's just a nice camaraderie with the smaller numbers. And you'll see in a little bit that we are growing, and we have increased in size over time, and we are continuing to grow as well. So that's pretty exciting.
Great. So now I'm going to tell you a little bit about some of the faculty interests and our primary research areas in the department. So we in the Environmental Health Department cover a lot of different aspects of environmental health. We have a special strengths in the department in WASH studies, water sanitation and hygiene, a lot of research on air pollution, pesticides. We focus on infectious disease ecology, a lot of research on children's health. We work on neurologic outcomes, endocrine disruptors, gene-environment interactions, the built environment, and global climate change. So you can see that it really covers quite a diverse set of environmental health topics, and with particular strengths at Emory in some of these areas. We, because environmental health is such an interdisciplinary area of research, we really have a diverse set of faculty with backgrounds in a lot of different areas. So we have faculty who have their PhDs in environmental health, and also in environmental science, environmental engineering, epidemiology, biology, chemistry, medical degrees, and even law degrees. And most of us within the department have joint appointments across other units on campus, for example, in the chemistry department, or in environmental sciences, in epidemiology, global health, many different joint appointments that reflect the interdisciplinary backgrounds of our faculty. So here are just some pictures of, so you can get a sense of our faces. This is the current faculty, and as Ariadne mentioned, we just hired a couple more people who will be coming in the fall. And we have a lot of joint and adjunct faculty, and those faculty are both from Emory, from other departments within Emory, but a lot of adjunct faculty from other organizations internationally, but a lot in the Atlanta area. For example, many joint appointment or adjunct appointments from people who are at CDC. And so these adjunct faculty are available for and really great resources for the students. So we have, here we go, what I just said, many faculty from these different areas, adjunct. So one of a really big strength in the department is our studies of water, sanitation, and hygiene. We have some of the leaders in the field in this area. At Emory houses the Center for Global Water, Sanitation, and Hygiene, Center for Global Safe Wash. And that is a program that is centered at Emory, but also involves faculty from Georgia Tech, Georgia State, and also people from CDC and the Carter Center and the Global Task Force. So there's a lot of interaction with the idea behind the center and behind much of the studies of water, sanitation, and hygiene is really to not just do academic research, but also see how that's applied in the field and understand how to improve implementation of these programs globally. Another really big strength of the department is our research in air pollution and health. And we have people in the department who address this from a variety of different angles, from the environmental epidemiology angle and doing advanced statistical analyses to understand the relationships between air pollution and health, integrating remote sensing data to it's a very unique approach of looking at using remote sensing data. And even one of our faculty, Yang Liu, has his own NASA mission to take images from space, and all the way to exposure measurements, where we're measuring levels of pollution in the outdoor air environment. So lots of different approaches in our air pollution and health work, and really strong faculty in this area. We also have extensive studies on the relationship between agricultural practices and their impact on human health, with one of the strongest analytic chemistry programs in the country. And we do applying this research. Dr. Dana Barr and Barry Ryan have a lab where they have programs in research programs in Thailand and elsewhere that really get at this question about agricultural chemical contamination and what the impact that has on human health. We also have a lot of strength in toxicology, with studies of disease pathogenesis. Dr. Mike Cottle and Gary Miller in particular, and Chang Zhang, who work on in this area. And in general, I mentioned the analytic chemistry work we have. This is addressed from both epidemiological studies and also chemical analysis studies. So strength of the department is this integration of a really strong analytic chemistry core with very strong methodological techniques in epidemiological analysis to understand where we can make inferences about occupational and community exposures and model those impacts on human health. And the pictures here represent a study, a big study that was led by Dr. Kyle Steenland in the department on the impact of PFOA contamination on human health in a community in West Virginia and Ohio. So each of those sort of different strengths get highlighted and get sort of organized into particular centers that we have in the department. So centers are a good sign of really strong research areas for a department. And we have, over the past decade, we've been increasing our presence in these areas by establishing centers. So in particular, we have SCAPE, the Southeast Center for Air Pollution and Epidemiology. And this was a collaboration with researchers at Georgia Tech and Emory that put together a lot of the air pollution modeling with the health impact studies of air pollution. The Center for Global Safe Wash, I already mentioned, is a convener for multiple studies on wash and global, and with a lot of studies all over the world on impacts of water sanitation, hygiene efforts to improve diarrheal disease and other child health outcomes. The GeoHealth Hub, based in Peru, is a research and training program that we have so that we're not just doing research on environmental health issues, but we're also training individuals in low-income countries to be able to do the research, and that involves both one-on-one training, short courses, and also opportunities for students to earn their master's and PhDs studying environmental health issues. So this really increases the capacity globally for environmental health research. Hercules is a big center we have funded by NIEHS this is looking at the Exposome, which is a kind of a vague but very important concept to understand lifetime exposures to chemicals. And this center not only does research and provides pilot grants for other researchers, but also does a lot of outreach work with the community in the Atlanta area. CChem Squared is a study of children's health, the environment, microbiome, and metabolomics. So this is getting at ideas about what is the impact, how do environmental exposures affect the gut microbiome, and how does that, what kind of outcomes does that affect in terms of reproductive health. CHEER is the Children's Health Exposure Analysis Resource. So we are one of the centers, analytic chemistry core labs nationwide, one of just a few that can do exposure analysis and analytic chemistry for health studies for children using biomarkers. And lastly, HAPPEN is the Household Air Pollutant Intervention Network. This is a very large trial where in 4 countries, and looking at the impact of air pollution on indoor air pollution and cook stoves, and introducing clean cook stoves as a alternative to reduce indoor air exposure. So, I guess, did I talk in front of the slides? So the Children's Health SAWAS Deep Birth Cohort, this is the analytic chemistry cohort in Thailand, where Dana Barr and Barry Ryan are looking at children's exposures and pregnant women's exposures to neurodevelopmental outcomes in Thailand. The Hercules Center, which I spoke about, helps fund research within the school and within the department and across other units on campus on gene environmental interactions and how the lifetime exposures are accumulated, which is the idea of the exposome, can affect these gene environment interactions. CChem Squared is the study that I mentioned that has recruited an African American birth cohort and is looking at the preterm birth as an outcome. And CHEER is the center that allows that supports other researchers across the country to enhance children's health studies by doing targeted and untargeted biomarker analyses. And lastly, the HAPPEN study, which I mentioned, which is this very large study across 4 sites internationally, focused on indoor air pollution in the developing world and impacts on health. And this is a very large intervention trial where clean cook stoves will be provided to pregnant women in these 4 different areas. So in terms of where the department is going, we are the fastest growing department at Rollins. We've had a tripling of our faculty over the past 8 years, and we're projecting, as we mentioned, we just have made 2 new hires, and we're projecting 10 new hires over the next 5 years. And the areas that we're hoping to expand in particular, are risk assessment, global and climate change. That is one of the hires we made. The built environment, the environmental microbiome, disease ecology, and computational toxicology. We started our doctoral program in environmental health sciences in 2011. We've now built the program to 30 students, and it is a very strong and thriving program. And we're also growing our MPH program. So now I'll turn it over to Ariadne, who will give an academic overview.
Thank you. Okay, so I'm going to go a little bit more into talking about degrees and programs, the prerequisites, and what we look for in our applicants, a little bit more about the curriculum, practicums, and employment thesis in our capstone, and then we'll actually probably have Stephen talk before we switch over to question and answer. So the degrees offered, I get a lot of questions about what is the difference between the 3 degrees in your department. So really we have 2 degrees and 3 programs, not counting the doctoral program. So we won't be addressing the doctoral program in this webinar, which we could talk about another day. If you are interested, please reach out to us. The environmental health MPH is everything that Karen was just describing. If all of those things sound exciting to you, I'll say that you found the right place, and it's just a matter of maybe selecting which program is better for you. Environmental health focuses a little bit more on the domestic perspective in the U.S., has a little bit more perspective with environmental health practice and domestic policy making, risk assessment, a little bit heavier in the occupational perspective. In our department, a little bit of history about us is we used to have the title of environmental and occupational health. And we just made it a little bit shorter, but we still have the occupational perspective throughout our curriculum. So people who might be focusing on the occupational would be more likely to look at the environmental health MPH program. The global environmental health program is very similar, except with the addition of interest of working in developing countries. So it's really taking the environmental health perspective on a global scale. And oftentimes the people who are involved in that program usually already have some sort of international experience or exposure and perspective. And moving on to the Environmental Health Epidemiology MSPH program, that's a joint program with Environmental Health and the Epidemiology Department, and that's the Master's of Science of Public Health. That one has a little bit more class requirements as far as the number of credits that are required, and a little bit more rigorous courses as far as the epidemiology perspective. The Global Environmental Health and Environmental Health Epi are both partnerships with the other departments, but they just happen to be housed in the Department of Environmental Health. Again, partly because of our size, and we are able to kind of manage these special joint programs between the two. And students who are in these joint programs really have the benefit of enjoying all of the resources from, for example, the GEH program, Global Environmental Health, also has a lot of connections with the Global Health Department, and the same with the Environmental Health Epidemiology students. With that said, we like to also say that everybody in our department and everybody across the school can access all of the resources that the whole school offers. So just because you're in environmental health does not mean that you're excluded from having access to any of these other departments as well. It's just that these particular programs are a little bit more formally tied as far as the curriculum and some of the faculty who they might be working with. But all of our students have the option to do international work, regardless of which program you're in, whether it's in our department or another department, and also have the option to take electives in any of the other classes. So if you're in Global Environmental Health and you also want to focus a little bit on advanced epi skills, you are more than welcome to take epidemiology classes as your electives. And same with the environmental health. You have flexibility between all of the programs, and so they are very similar, and we just say continue to investigate, for example, the specific curriculums and which one might be better for your the goals that you have right now as far as what you'd like to do for your career. And also, people have asked me if it's possible to switch between the programs once you are here. And what we really try to do is encourage you to be in the right place at the beginning. So we're more than happy to talk to you and answer all the questions that you might have as far as exploring which program might be better for you. But with that said, most programs and most departments do allow people to apply to switch while they're here. Usually that would happen after your first semester before you start your second semester, just to help make sure you stay on track. We don't think it's the best path for you, but we also do know that we want you to be in the best place once you are here. So some programs and some departments say if you've applied to that program or department once upon entry and you were not admitted at the first review that year, that sometimes they will not review you a second time within the same year. So that's something to keep in mind. And then also to keep in mind that Rollins does allow you to have 3 program choices when you apply to the program. So you'll apply to your first one in SOFIS, and then offline through Rollins, you would indicate if you're interested in being considered for a second and third program. So oftentimes we do see maybe even all of our programs listed in the order in which you'd be interested in being considered for them. Obviously, you can list whichever ones you want across the whole school. So we can help you decide that as you move through the process. As I mentioned, we have the 5-year program with the undergraduates, and then we do offer several dual degree programs. And that is something that we have a link for all of our dual degree programs, and you can look a little bit more into that. I see it's listed with MPH PhD in Environmental Health Sciences. We actually don't have a dual degree with the MPH PhD right now. That actually should have just said dual degrees with MPH within environmental health. So that is something that we'll make a correction about. So sorry that I just realized that was incorrect, but we do have several dual degrees with the MPH program across with other programs at Emory, and that link and the admissions website for Rollins has all the dual degree programs that we partner with. So tying in with all the interest areas that our faculty are working on, our students are gaining skills in all of those areas as well. So the general overview, foundational skills that all of our students will be learning through our required classes include hazard recognition and control for environmental hazards, risk assessment, environmental policy, epidemiology as it relates with the environmental health perspective, toxicology, program implementation and evaluation, and ecology, demography, and environmental science. So because of those core skills that you'll be gaining here, we really do ask that students have applicants come in with chemistry and biology. We get a lot of questions about those prerequisites. You can apply to our department without those prerequisites, but if you are admitted, we will ask that you take them before you come. And we have some resources about how people can get those before they come, before the classes start next August. We also do recommend, and it's helpful for students to have calculus, statistics, organic chemistry, and physiology. That foundation helps students to be more comfortable and more successful with their required classes and the foundation classes, and to be able to get more advanced. And again, as you saw from the beginning slides, is that we really do have that very broad range of molecular to the more broad perspective, and therefore our students really come from a really broad background. So some of them are going to be very scientific and biology majors or chemistry majors and have a lot of lab experience and have done that kind of research. And then we have really more practice-based students who are coming from maybe some social sciences. We have MDs who have come back to school. We have people who have had anthropology. We've had a music major here before. So it really is broad as to the background of where students come from, which is why we don't require chemistry and biology on your transcript before you apply. Some of you might have 5 or 10 or 15 science classes, but we also realize that not everybody has that science background. And again, some undergraduate programs might just require 2 semesters of chemistry or biology, so you might be just missing one of those. And that is common, so don't be deterred about applying if you're interested in our department. Also, for the global environmental health applicants, oftentimes we look for a strong global experience and background that just gives you a little bit more foundation for starting the classes and the focus areas that the GEH students work in. And for the environmental health epidemiology MSPH program, we do look for strong quantitative ability. And I know also, again, I get a lot of questions about test scores and grades. And so I will say that for the EH Epi program, the stronger the quantitative scores and background, the more likely it is that you would be admitted. So for the curriculum, just a bit of a nutshell, this is really across Rollins. This goes for all of the programs. That it's 42 credits for the MPH and 48 credits for the MSPH. So Rollins works on a flat rate tuition where you're paying per semester at a full-time status unless you're part-time, and then it's a different structure. But most of our students are full-time. And the minimum is 9 hours enrolled per semester, and the max is about 16 or 17. So people have a lot of flexibility as to how many electives they want to take, especially as you move out of your first year and into your second year. And that's where I mentioned you can take classes anywhere not just in our department, not just at Rollins, but you can even take classes across campus at Emory. And if Emory doesn't offer a class, we also have an exchange program that's included in your tuition to be able to take classes across Atlanta, places like Georgia Tech or Georgia State. So we would encourage you to go online and look at our course descriptions and sample syllabi that we have posted on our department webpage. And also just to mention that we require a practicum and a culminating experience, which I believe I will talk about more in a minute. All right, so the curriculum, every program has specific outline of what the classes are that you're required to take. Every program across Rollins will be taking a core class, which is a foundation class in the other departments, which gives you your foundation across the school. And then you also then go into your program required classes. So if you want to look and see which of the programs, again, fit your interest, it's a really great thing to come to the curriculum sheets and look at what are the required classes and which ones sound more like a fit for what you're interested in learning. So the practicum is required also across Rollins. It requires 200 to 400 working hours in a public health related position. And this can start after your first semester here or after you've taken 9 credits at Rollins. So when you're working, starting as soon as January of your first year, you can start counting it toward your practicum requirement. And we have a lot of resources to help you find those jobs. Being that it's required, we give you the support along with everything else that you need to get through our program to be able to find these practicum positions. We don't line people up directly with the practicums. We do say it's like looking for a job, but we just give you a lot of resources to be able to find those positions. And throughout your time here, we are part of our job is to help build up our networks and our partnerships, as well as all the past practicum opportunities and places that our students have worked are really great resources for our students. So you have a very robust network and history of where people have been doing their practicums, and the sky's the limit. If you find somewhere that's no one's ever been before, you can find your own job and say, hey, I want to work here. You could even volunteer to get that experience. So it's very broad, and everybody graduates with this requirement and taken care of, so we can guarantee that everybody will find a position while they're here. Here's just some examples. Yeah. All right, some examples that you can, just some titles so you can see where people have worked. All the places where we're mentioning that we are doing the work, from the centers to our faculty partners, all of those places have potential for students to come work for them as essentially an intern or a student employee. So they've worked here through the Center for Global Safe Wash, all the way National Center for Environmental Health, Population Research Center, the EPA, and then all the way down to nonprofits and small NGOs in developing countries, to CDC, and there's lists and resources on our website, especially through Career Services if you want to click through the database, but we just pulled out a couple so you can see some of the titles. Most of our students are working while they're here, so they start on pretty much day one. I know a lot of students contact me over the summer about working with faculty, and in our department, we really ask that students start networking when they get here, starting orientation. So our faculty are not necessarily posting jobs for people to apply to early, also to keep it sort of on an equal playing field with all the students who are coming in looking for a job. There are student fairs for jobs when you guys first get here. There's opportunities. Our faculty will be posting all of their positions then, but students are working pretty much as early as they are getting here, and we do know it takes a little bit of time to get started finding a job. Your first semester, it would just be considered a job, and your second semester, that's when it can start counting toward a practicum, and you're getting the real-world experience. Ideally, outside of Emory is where you would be doing your practicum. So some students just start working with faculty in their first semester, or you can get a job anywhere else that will be willing to hire and pay you. So most of our students, I'd say probably at least 95%, I think, of Rollins students are working at some point. The Culminating Experience in our department, we offer a thesis or a capstone project, and it depends on your program. If you're in the MSPH program, the thesis is required, but one is more research-based and one is more practice-based. And this is something that you kind of start thinking about from the beginning of the program, but you really focus more on it in year 2, and we help you throughout the process to make that happen as well. When you get here, you have a faculty advisor assigned to you, and you also have an academic advisor, which is someone like me, whether it's I'm the academic advisor for this department, but every department has 1 or 2 ADAPs who are there to help you from beginning to graduation. And also in our department, we have a program where we assign you to a second-year student mentor. That's a student-led program that we have our second year serve as volunteers to help you guys out when you come in and guide you through the first year, and just at least to have a friend who's not necessarily a staff or a faculty member, and you can ask questions to, a little bit more personable than maybe just being on a Facebook group. And then you also have an optional professional mentor through the Rollins Career Services program as well. Just to mention that there are lots of funding opportunities. I get a lot of questions about that. I really would say spend some time on the finance page for that the Rollins admissions program has. If you are admitted, you have access to the new admitted student portal, and that has a lot more information about funding opportunities, but just so that you know that there's a lot of places to research about that. If you're interested in asking more questions, start with the admissions department that put together a lot of resources for you. And if you have specific questions about environmental health, I can answer those as well. All right, so I'm going to turn it over to Stephen, and he's going to tell you a little bit of his perspective about student life here at Rollins.
Okay, everybody, thanks for joining us this afternoon or evening, depending where you are. And so my name is Stephen, and I am, as I said earlier, I'm a second-year environmental health epidemiology student, otherwise known as EHEPI. We love our acronyms here at Rollins, as you'll see shortly. And so I want to talk to you about student life here. So just a little bit about me. I am originally from Concord, California. And after, a long winding path, I found my way here to Rollins. I was a Peace Corps volunteer in Indonesia before coming here. And so as you can see up there, my practicum was actually based back in Indonesia with UNICEF. And I did a lot of interviews and focus group discussions with people in Indonesia, with the Ministry of Health, with community members, with local government officials about subsidies on Indonesia's nationwide clean water and sanitation program. My focus here at Rollins is WASH, water, sanitation, and hygiene. And so my practicum involved WASH as well. For my thesis, which I am currently working on right now, I am looking at the risks of diarrhea and acute lower respiratory infections in Eastern India. Yeah, that's a lot of fun because the thesis is an opportunity to take everything that you learned in all your classes these past 2 years and combine it into one program, combine it into one project, and it really helps to reinforce all of the things that you learn. Campus involvement, I was associated with the Rollins Student Government Association. I have a list of the organizations later on. And then I am also part of the Emory's 1915 Scholars Program, where I'm a mentor for first-generation students. For work, I work approximately 20 to 25 hours per week across 2 jobs on campus. That's also because I don't have a car, so it would be kind of inconvenient if I found a job in downtown Atlanta. So I instead found 2 jobs here on campus, and I love it. So we have a lot of interesting classes at Rollins. I won't go too much in depth with these due to time, but there are class lists online that you can take a look at. So as I've said, I've taken quite a lot of classes here in the WASH field. I've loved my GIS classes where we make maps of diseases and look at clustering and hotspots and all those fun things. And I have been taking a lot of epidemiological methods classes and also classes in biostatistics, which I wasn't a big math person before coming to Rollins, but I've ended up learning to love math, actually. It's been quite fun. Um, so, like I said, we have a lot of student organizations here at Rollins. We currently have 16 registered organizations, and we have them for everything that you can imagine. And as I said, we love our acronyms here at Rollins. So each one of these organizations has their own acronym that they go by. Um, yeah, and if you look at these organizations and you find something that you're interested in and that isn't offered, you can always start up your own organization. And that is done through the Rollins Student Government Association, and they also provide you funds in order to do that. Quite a bit of these organizations have their own fundraising mechanisms as well. Something that I want to mention that isn't on here is that something special about the class schedule at Rollins is that we don't have any classes from 12 to 1. And so nobody has any classes from 12 to 1. And so we have quite a lot of interesting speakers come in from the CDC, from Atlanta, from other universities, even international speakers. So anything that you're interested in studying here at Rollins, you will be able to find someone who is interested in it, whether it's a student or a PhD student or a professor or an outside mentor. So I found that really, really interesting. I've gone to some really interesting talks about anything that you could ever think about, and even things that you would never even think about. Quite a lot of opportunities here. So another big thing that is housed in the environmental health department is the climate at Emory. So it's interdisciplinary and it's actually a university-wide initiative. We have one of our instructors here at Emory, Daniel Rockberg, who kind of leads this. He has quite a bit of experience working with the city of Atlanta and working on an international scale. Emory University, as a university, they send students to the COP23 climate talks. I think the last one was in Bonn, Germany. There's been one in Paris and Marrakesh. So if you're interested in climate, that's a big thing in environmental health, and that's something that you can easily get involved in here. Just some more student life. Atlanta's a great city to live in. And this is me coming from California. I love living in Atlanta. There's so many opportunities to get involved outside of Rollins. We have a lot of farmers markets. We have intramurals on campus. The Appalachian Trail starts in northern Georgia, as you may know. We have beaches, 4 hours drive to the east. Savannah, Georgia is beautiful. We have Augusta. Just this past weekend, in fact, I went on a spontaneous camping trip with my roommates. So one of them just bought a tent recently, and so we went on a camping trip. And so there's lots of places to go explore on day trips or overnight, whatever you want to do. Atlanta probably has it. So that is all that I have. And of course, there's quite a bit of things that I wasn't able to cover, but you can always email me if you have any student life questions, or if you think of anything afterwards and be like, oh, Stephen, I want to know more about, classes that you've taken, or how you found your practicum, or how you found interacting with the professors and things like that. I'm always up to answering any questions that you have.
All right, thanks so much.
Yeah.
Well, we've opened the floor or the webinar for questions, and so please feel free to type them in as we go, and we'll answer accordingly. So one of the first questions, how long will the MPH PhD take?
So that was the correction I had made on the slide, is that so Rollins we don't have necessarily a MPH PhD program track in our department. The way that Emory works for the dual program with PhD and MPH is that you have to be in a PhD program first and indicate that you're interested in potentially getting an MPH while you're in your PhD program, and then you can apply to the MPH program with the support of your doctoral program. For our department specifically, the MPH and PhD, both in our department, would be redundant if you're in the PhD program first. So most of our successful applicants for the PhD program already have an MPH or a master's degree in a related field. We don't require that students have it, but so the process would be, we recommend that you take, if you're interested in environmental health, both MPH and PhD, you could consider getting your MPH first and then applying to the doctoral program. Whether it's both at Emory or otherwise. If you are applying to the PhD program and get into that, you would not also be getting your MPH in environmental health.
I'll just add one more note, which is that many times we have applicants to the PhD program who we feel if they don't have an MPH or other master's degree, we feel need to have a little bit more public health experience and training before starting the PhD program. So in many cases, we'll recommend that the PhD applicant first do an MPH, and then they can apply to the PhD program once they've done their MPH.
Great, thank you. So we have another question regarding where does the environmental virology lie on the 5 program?
So I believe the question is asking about if you're interested in environmental virology, where within the different 5 programs that we offer would environmental virology be studied? And so I think this question is less about which MPH program to enroll in, because more about which courses to take and which research to get involved in at Rollins. So and we don't have a particular environmental virology course. I teach environmental determinants of infectious diseases. There are microbiology courses at Emory in the college. And then we have specific members of the faculty who do environmental virology work. So in particular, I do environmental microbiology work, and other WASH faculty also incorporate environmental microbiology into their research. Joe Brown at Georgia Tech, who is co-appointed in our department, or adjunctly appointed in our department, I believe, does a lot of environmental virology work. And also Christine Moe in the Global Health Department does quite a bit, specifically focused on norovirus, and has norovirus challenge studies and also norovirus recovery programs. So there is environmental virology work going on at the school, but there's no particular program for it.
And I also think this will be important to reiterate. Even though you're in the MPH-EH program, that doesn't mean you can't take classes in other departments, such as global health, or maybe, in the epi department, or even if you want to take classes in the behavioral sciences and health education department. You're more than welcome. Of course, there are priorities given to certain students, but you are still able to take those classes if there is space available.
Great, thank you. So do you all have a specific GRE cutoff?
We do not have a specific GRE cutoff. Our application reviews are on a holistic perspective. So we focus really on the whole application, looking at the grades and transcripts and letters of recommendation and your personal statement and your career goals and your experience. So really the whole perspective. We do know that test scores are not everything. We do take it into consideration, I will say the test scores are considered a little bit stronger for the EH-EPI-MS-PH program. And also, again, it balances things out. If you've got a strong transcript, for example, and lower test scores, then we also know that it might be more of the test taking factor. We also do encourage people to address anything that you would like to have the reviewers know about you or your application in your personal statement. So that's a really nice place to be able to explain maybe a low score or a low grade or something that might have been going on. And I think sometimes, again, the holistic perspective helps to let us to get to know you a little bit through the application.
All right. So do students in the MPH programs get a chance to work with faculty on their projects? And are they included in the faculty grant proposals? And is that another possible way for getting funding for the graduate program?
So I would say that all faculty incorporate students into their research projects, and the opportunities will vary from year to year and from faculty to faculty, depending on what kinds of projects are funded within somebody's research program. And each faculty member is different about how they work with graduate students, but there always are students involved in different research projects. So for example, within faculty grant proposals, when we're writing grant proposals, we always include some funding to support MPH and PhD students. And I'll let Ariadne speak to the question about whether that's a way to get funded for the grad program.
So our master's students are not funded through faculty grants. Our master's students have an opportunity to work with faculty as being hired as a student employee, and that would be at an hourly rate. It would not be going toward your tuition directly, so we don't have assistantships per se, not through this mechanism. So all of the funding that would help you, funding for the graduate program, will come through your financial aid award or the merit scholarship process. So that is all going to be centrally funded and available through Rollins admissions and financial aid. So the departments don't offer any special scholarships or assistantships like that. But as I said, most of our students are working, and in the first semester, especially when people are starting, a lot of them are finding positions with faculty, but that would be at an hourly student employment basis. One thing just to note, the reason why I keep saying the first semester working with faculty is just to reiterate that when students start their practicum requirement, that we do have you do the practicum outside of Rollins and not working with faculty, because we want you to get more real life experience or real world experience outside of academia. So some students, like Stephen was saying, that he has a couple jobs across campus, but those did not count toward his practicum, but that was just a way for you to get money in a weekly or biweekly paycheck. So it's a little bit of a different structure than some other schools might have.
And also in terms of a thesis, so the thesis has to have the backing of a faculty member inside the environmental health department. You can do it with the CDC, you can work with our partners at the CDC or other places, but the faculty member has to be involved when you're working on a thesis, or we also have the option to do a capstone project as well.
All right, thank you. So would you all happen to know whether funding for the PhD program for international students is guaranteed after admission?
For the PhD program, it's quite different from the MPH program. Our PhD students, when they're admitted into the program, are guaranteed funding for the program. That is covered differently for international students than U.S. citizens, but that is more our problem to figure out than the students' problem, because it just depends on the kind of the way that we've been allocated spots by the graduate program, and so we move things around accordingly to support international versus U.S. students. So the way that the program works is for the first couple years of the program, PhD students are supported by the graduate school at Emory, and then they move on to faculty research grants or what?
Or their own.
Yeah. So that's right. Or students can secure outside funding to support their stipend and research programs. So there are different ways to that after the second year, there's a lot of different ways that the funding model can look, but our goal is to support students for the whole time that they are in the program.
Students, again, we're not necessarily focusing on the doctoral program, but doctoral students who do find their own funding also get a bonus from the graduate school toward their stipend. So it is encouraged and rewarded for those who are able to find their own funding, and faculty help with that process. But for a lot of people are partnering with faculty in that way as well.
Thank you. Okay, so we have a question in regards to visiting Rollins and the department. We have an awesome opportunity coming up in April. You can sign up for it. It's an information session, and during that you have about a 20-minute or 30-minute admissions presentation. It tells you more about the application process, the review process with the different departments. You also have a panel that includes an alumni member, a member of career services, and a current student that you get to ask questions to. And then you have a chance to mingle and ask questions with all of the departmental ADAPs who are there manning a table, as well as career services. And then it concludes with a tour. So I invite you to please visit our website and go to the visit. There's like a tab for visiting, and you can sign up and register for that upcoming session, and it's in April. And if you are interested, you can also, after the session, apply for a travel grant opportunity, because we don't offer it for just personal tours, but we do for information sessions. So if you're interested in visiting and learning more about the 5 programs or the different programs, you can definitely sign up online. We have about 2 minutes left, so are there any final questions that you have before we conclude the webinar? We've got 1 minute left.
I'll add one more little thing, and then if anybody's typing something in, we'll hang on for a second. But just want to remind you, if any of our admitted applicants are on the line today, we definitely encourage you to come to visit Emory, which is coming up in March. So check your emails about that as well.
March 22nd and 23rd. Yep. All right. Oh, sorry.
Any other questions?
All right. Well, we thank you so much for attending the webinar today. We hope you have a wonderful rest of your day or evening, depending on where you are. If you have any questions, please, again, feel free to reach out to us, and we'll be happy to answer accordingly. Again, have a great day, and thank you for attending.
Thank
Thank
you.
you.
Thank you.